Ballot Measure 50, and why it's important to all Oregonians. Let's be very clear. This is big tobacco versus our children. Big tobacco versus human beings. And let's be even more clear. That tobacco is the most costly, destructive, and deadly drug ever introduced into the American society. You take all the illicit drug deaths in this country, these are national figures. Heroin, cocaine, methamphetamine, about 19,000 to 20,000 a year. All alcohol-related deaths, 80,000. Tobacco, 400,000 Americans die annually from tobacco. And it is the most expensive drug ever introduced into the American society. The healthcare costs that we all bear into the tens of billions of dollars nationally. But I believe probably the best way to explain the measure is to address some of the ads that the No on 50 campaign has actually put on the air. The first argument is, oh my gosh, this is a constitutional amendment. I mean, that cigarette tax has no business being in the Constitution. Well, let's get past that right away. Unfortunately, the Oregon Constitution is not that pure, sacred document we all want to believe it is. It hasn't been that way for 100 years. And even just recently, measures like Ballot Measure 5 that capped how much tax can be put into schools, Ballot Measure 11 that actually constitutionally mandated the length of prison terms, Ballot Measure 99 that provided in-home health care to our seniors, Ballot Measure 47 that put a cap on the rise in property taxes, who you want to marry or who you can't marry, even how wine is served in a glass in restaurants is in the Oregon Constitution. So let's just get past this, it doesn't belong in the Constitution argument. But the biggest reason it should be in the Constitution is that I absolutely believe that every one of our children has a constitutional right to health care. That's the biggest reason it should be in our Constitution. Some of their ads address the fact that 70% of the funds don't go to children. Let's be very clear. The Oregon legislature was fiscally responsible and prudent in crafting this measure the way we did. And yes, let's make the assumption that the measure passes on a Monday. We don't have all 117,000 uninsured children enrolled on Tuesday. It takes time to enroll those eligibles to actually get them into the health care plan. So we do sequester the money into a savings account specifically for children. And in addition, we also put a small amount into TURA, tobacco use reduction, federally qualified health clinics like you have right here in Astoria, and some into school-based clinics to improve mental health services for children. You have a third ad, a third thrust, if you will, that decries it's an unstable revenue source. Let me tell you that compared to Oregon's most volatile revenue structure in America, where we fund everything else, cops, prisons, K-12, a gently declining tobacco tax is the Rock of Gibraltar compared to the rest of our revenue structure from which we fund all other public services. Earlier I alluded to the fact that this is the most costly drug in American society. The Centers for Disease Control, CDC, these are their numbers, not mine, estimate that every pack, not carton, every pack of cigarettes sold in this country costs over $11 per pack. It's about $5.50 in lost wages and productivity, and that's a discussion for another day. But fully $5.50 in direct medical costs. So if you want to smoke, that's fine with me. This is America. Just don't ask me to pay your costs. You want the privilege, the enjoyment of smoking? Fine. Don't do it in a room where I am. Do it someplace else. But don't ask me to pay your costs, because that's what you're doing. That's what's going on right now. That means we're subsidizing every pack of cigarettes sold by $3.50. And who's paying for that? Every one of you in this room and everyone that's listening to this broadcast today. This is very clear that the RJR and Philip Morris have put over $11 million into this campaign in 4 months. Now let me put that in perspective. Last gubernatorial cycle, Ron Saxton spent $8.5 million. Ted Kulongoski spent $6 million. But they did it over 2 years. This is $11 million in 4 months, and without question, is the most expensive campaign in Oregon political history. The whole issue of taxing a specific product use, I don't care whether these folks are low income, I don't care whether they're high income, it is the cost fairness issue, because it costs so much to provide health care directly related to the use of this given product, in this case, cigarettes. It's been brought up that, this unfairly, benefits only one segment of society, only children. Let me point out that all health care is paid for. Every dime of health care is paid for. I don't care if you're Rockefeller and you go to the hospital and you pay cash on the barrelhead, or you're Billy Bob or Sally Sue, poor person, go to that same hospital and can't pay. Who ends up paying for Billy Bob and Sally Sue? We all do. All health care is paid for. So when you're shifting those costs to all of society that tobacco creates, that tobacco forces us all to incur, that is the fairness equity. That is the fairness issue that makes this measure not just important to children's health, but helps lower all of our health care costs. The subsidy, the cost per pack, as I indicated, was $5.50 per pack, direct medical cost. So if there are fewer packs sold, we will certainly be getting more money because the tax is higher, but it will be declining. Where the additional money comes from is the dollars we save in providing healthcare services that aren't necessary, because we're saving that $5.50 per pack. This is so important for Oregon. Look at what this is about. Sometimes you're known by the friends you keep. In this case, the opposition to ballot measure 50, a very reasonable plan put forward by the legislature for the approval of Oregon voters. The company the opposition keeps is big tobacco. And I'd invite each and every one of you in this audience or in the listening audience to reach into your pocket and pull out the smallest denomination coin you have in your pocket. And whatever that is, even if it's a penny, that penny is more important to you and your net worth than that $11 million is to the tobacco companies that's putting universal health care for our children at risk. Now think about that. You got out-of-state corporations coming in here spending more money than any other campaign in history to deny health care to our children. You are known by the company you keep, and that's who the opposition to ballot measure 50